Have you ever heard of organ donation? Perhaps through your favorite medical TV show, such as Grey's Anatomy, The Good Doctor, and New Amsterdam. In Canada, and particularly our province, Ontario, at 16 years old, Service Ontario will send you a letter to opt into organ donation. In this letter, you will indicate if you do want to donate your organs and which organs you want to donate. Now, you may be wondering, what is the purpose of organ donation? Donating an organ allows to save the life of a sick individual and also improve their quality of life. But when we say organs, which ones are most commonly donated? You can donate your heart, liver, kidney, lungs, and pancreas. A lot of people don't know this, but you can also donate your skin, tendons, bones, and cornea. To put this into perspective, one donor can save up to 8 lives and improve the lives of 75 individuals. Very significant. Now, after an individual who has opted into organ donation passes away, the organs are retrieved in surgery. But how do we preserve them until they get to the recipient? The most commonly used technique is called the traditional cold storage technique, which involves placing the organ in a conservative solution with ice at 0 to 4 degrees. Now, that we've talked about traditional cold storage technique, we have to acknowledge this technique is older and that it carries many disadvantages. And that's why today we're exploring the newest advancement in organ donation, which is Normothermic machine perfusion, a brand new preservation technique. But now, what really is normothermic machine perfusion? It's a preservation method that puts the retrieved organ into a box and allows the perfusion of blood. So we're pumping blood into that organ continuously, basically keeping it alive. And also, we're keeping it at 37 degrees Celsius. That way, we're entirely mimicking the environment and conditions of a human body, so the organ is technically still kept alive. But why exactly is normothermic machine perfusion better than cold storage techniques that we're used to? Now, normothermic machine perfusion both prolongs the preservation time and improves organ viability. But what can normothermic machine perfusion be used for? We're currently looking at different machines for the different organs that we can donate, including heart, liver, kidneys, lungs, and pancreas. But today we'll be taking a special look at the liver, and specifically the Metra, a liver normothermic machine perfusion made by the company OrganOx. This is a closer look of how the machine looks like from the inside. Now let's explore the different components of that machine. In the machine, we have 4 main components: a reservoir, an oxygenator, a pump, and medicine and nutrition. Starting with the oxygenator, which is responsible for taking concentrated oxygen from the air around us to supply it to that liver. Next is our reservoir, which is actually where we have the oxygenated blood stored. Then we have our pump, which pumps the blood into the liver. And lastly, we have the medicines and nutrition, which just allows the liver to stay healthy and nourished. With any machine comes different specifications, so let's explore them. First thing, the Metra has such a robust design that allows for ease of transport and safe storage. Then in terms of automation, we have such a simple control panel with 2 main buttons, which is what gives it the ease of use specification. And lastly, the Metra machine comes already set up and all the parts are disposable, which are very easily disposed of at the end of the procedure. Now, we've mentioned that we prefer normothermic machine perfusion over conventional static cold storages, but why? So if we do compare with our traditional methods, it's up to 12 hours of organ preservation versus with our current machine perfusion, it's up to 24 hours of preservation time. Now, the Metra also allows for organ assessment. With the organ having longer preservation time, it allows for the physicians or the doctors to look at any abnormalities within the organ before it's transplanted. And lastly, it has a higher transplant success rate because it's getting fully pumped with blood and kept at physiological temperatures of the body, which reduces any injury to the organ before it reaches the recipient. But now,
with every new medical decision or technological advancement, we have to consider all the implications. First is the financial aspect or the cost. So for the Metra, it's actually expected to be an average of 20K per round, so $20,000 Canadian dollars per round of using the Metra. Other implications would be the societal implications as well as ethical implications that we may come across when using this new machine.
Now, as Canadians, will we be seeing it in Canada soon? In 2025, which is this year, the Metra has been approved for commercial use, which means that our hospital will be able to purchase them and implement them into surgical treatments. Now, we have not reached this decision lightly, and we've ran multiple clinical trials. The first clinical trial in Canada was by Dr. James Shapiro from University of Alberta in Edmonton, and the second clinical trial was by Dr. Marcus Selzner at the University of Toronto in Canada. Now, what are your thoughts on normothermic machine perfusion as a new method of preservation after this video? Also, let us know if you know anyone who has donated or received an organ within your family and friends. Thank you for watching.